Hello everyone, welcome back to my next video. This is I will teach about ECG. So what is ECG? At first the full form of the ECG, this is electrocardiogram, and for the ECG we need to know something like that. What is the heart conduction system? In the heart conduction system there is a SA node, and SA node is present in the left atrium, and from the SA node electrical impulses is generated from the SA node, and from the SA node the electrical impulse is carried out from the SA node to the AV node, and from the AV node this transmitted through the bundle of his then Purkinje fiber, which is present in the two ventricle. Then so what is electrocardiogram? Electrocardiogram mainly a graphic representation of these electrical impulses of the heart. Which impulses is need to beat the heart, or which impulses is mainly beating the heart properly in a rhythmic way. So this is called the electrocardiogram or ECG. In the ECG there are so many waves like P wave, QRS complex and T wave. Here is this P wave. So what is P wave? In a normal ECG, so what is P wave? P wave mainly originate the depolarization of the atria, or P wave represent the depolarization of the atria. Which is depolarization of the atria? When the blood comes into the atria, then atria is constructed. For the atria is constructed so that the blood goes from the atria to the ventricle, and atrial construction is called the depolarization of the atria. Then the P wave is formed because it is a graphical representation. Then the QRS complex. In the QRS complex, it is mainly represent the depolarization of the ventricle. When the ventricle constricted, then the depolarization of the ventricle occurred. Then a QRS complex. Here is a QRS complex, means it is the most of the beating of the heart. The QRS complex found. Then the T wave. What is T wave? It is represent the repolarization of the ventricle. What is repolarization of the ventricle? It means ventricle is relaxed from after the blood comes out from the heart. It is a normal ECG. In the normal ECG there are PR interval like P. There is the starting point of the P to the starting point of the R. This is called PR interval. And Q, the starting point of the Q to the end point of the T. This is called the QT interval. And this is the QRS complex. It is the PR segment. It is the ST segment. Then the ECG machine, in which we do an ECG, and in a modern ECG machine we collect some data like PR interval, QT interval, corrected QT interval, PR axis, QRS axis, rhythm rate. Also this is we can found from the ECG machine. Any type of deviation from the normal ECG, this modern ECG machine can detect properly. Electrodes and leads. What is electrode and lead? Electrode and lead mainly it is a part of the ECG machine, and electrode and lead mainly it is detect the any type of deviation of ECG, or to do the ECG this electrode and lead is mainly essential. There are 12 recording lead. It means the 10 electrode attached to the body are used to form a 12 lead ECG. 10 electrode and 4 electrode is mainly placed into the limbs, and 6 electrodes are placed into the chest. It is mainly collect the electrical potential from our heart. Then the electrode name, the RA marked electrode is placed on the right arm, and LA marked electrode is placed into the left arm, and RL marked electrode is placed into the right leg where the calf muscle is present. Then LL marked electrode is placed into the RL, or the left leg. Then V1, V2, V3, V4, V6. These 6 leads are mainly placed in the chest to collect the electrical impulses generated from the heart. V1 in the fourth intercostal space, it is mainly placed. but just right to the sternum. And V2, it is also placed in the fourth intercostal space but in the left to the sternum. And V3 is placed mainly V2 and V4, and V4 is placed in the fifth intercostal space in the mid clavicular line where our collarbone is found. Then we draw a mid line, then the mid clavicular line just beneath the nipple. In the V5, it is horizontally even the V4 and in the left anterior axillary line, and V6 mainly horizontally even V4 and V5 in the mid axillary line. This is the lead placement. Here, this is the V1 in the right side, and it is a V2 left side, V3, V4 beneath the nipple, V5 and V6. Then it is a graphical representation of an ECG. This is, you can see here. This is a ECG, and a ECG paper consists of many small and large blocks. There are a 15 large block. It means this is a large block, and each large block is consist of 25 small boxes, and these 25 small boxes, each small boxes is represent 0.4 second. So 25 small boxes is represent 0.2 second. As well as you can see here, these five large boxes is represent the 5 into 0.2. It means 1 second total box. This is the P, and Q word is T and U. Then I come to the rate and rhythm of the heart. In our heart, there is a pulse rate or heart rate. Our normal heart rate is 60 to 100 beats per minute. But if there is a below the 60 beats per minute in the adult, this is called the bradycardia. And if there is a more than 100 beats per minute in an adult, this is called a tachycardia. But in children, their heartbeat is more faster than in adult. Then medical uses of ECG. When we can do ECG of a patient. When patient is admitted with or patient is complaining the chest pain, STMI or myocardial infarction, non-STMI, symptoms such as SOB, murmur, fainting, seizure, funny turns or arrhythmias, medication monitoring, electrolyte abnormalities, perioperative monitoring, cardiac stress testing. Then the normal sinus rhythm. This is a normal sinus rhythm. You can see here the P wave, and it is a QRS complex. It is a T wave. This is a normal sinus rhythm. In the normal sinus rhythm, how can we calculate the heart rate? Here you can see in a 6-second graph, we can calculate at first the P wave. How many P wave is there in a 6-second chart? 1, 2, 3, 4, 5, 6, 7. There is a 7 P wave. So to calculate a heart rate, we need to multiply this P wave with 10. It means 7 P wave into 10 equal to 70. It means in this graph their heart rate is 70. In the normal sinus rhythm, all is normal. The PR interval, it is a normal 0.12 to 0.20, and QR is also normal 0.06 to 0.12, and normal heart rate 2. Then the sinus bradycardia. In the sinus bradycardia, there is a electrical impulses which is generated from the SA node and transmitted through the AV node. This is the normal and rhythmic wave, but in the SA node, the action potential generation is delayed, or the electric impulses which is generated in the SA node, it is delayed and decreased. So the heart beat is delayed. 1, 2, 3, 4, 5. This is a 5 P wave. It means 50. It means less than 60. In the normal adult, there is a called the bradycardia, but it is a sinus rhythm. In the sinus bradycardia, the definition, it is a heart rhythm that originates in the sinus node which rate is less than 60. When it can occur, it mainly occurred in the sleep, but inappropriate sinus bradycardia caused by numerous factors like hypothermia, hypothyroidism, sick sinus syndrome, seizure, poisoning, etc. Then sinus tachycardia. When from the SA node, the electrical generation is increased. It means the electrical impulses generation is mainly increased in the adult, and this transmit into the AV node. It is also increased. This is called the sinus tachycardia. For this, the heart is beaten more faster than the normal. Here you can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then the heart rate is 120. It means this is called tachycardia. The definition is that it is characterized by pulse rate more than 100 beats per minute. It is an electrical signal originated in the SA node is more faster. It is mainly result in the normal adult as the alcohol or caffeine ingestion, exercise, drug, anxiety. Inappropriate sinus tachycardia mainly occur from the hypotension, hypoxia, CCI, bleeding, cardiomyopathy, myocarditis, anemia, fever. Then the atrial fibrillation. You can see here there is a no P wave. We cannot mainly recognize the P wave. How it is formed? When in the atria there is a sinoatrial node or the SA node is mainly originated the electrical impulses, and when the atrial fibrillation occur, the sinoatrial node cannot generate the electrical impulse, but apart from the SA node, another foci or another ectopic foci is generated these electrical impulses. For this, the proper atrial contraction does not occur, so that this is the P wave occur. This is the non-recognizable P wave is occur, but QRS complex is also normal. This is called the atrial fibrillation. Rhythm also irregular. Rate is very fast, more than 350 beats per minute, because there is more P wave, but we cannot recognize. Then the definition. It is irregular heartbeat which is frequent, rapid. It occurs when the atria beats chaotically. Symptoms like SOB, exercise intolerance, heart palpitation, and weakness. Then the electrophysiology. Mainly when apart from the SA node, one another foci or one another ectopic foci of electrical impulses originate from this ectopic foci, but not from the SA node. Then the atrial fibrillation occurred, but QRS complex is normal. Then the atrial flutter. Here you can see the P wave is a wavy form. When the SA node cannot generate the electrical impulses, but a single foci rather than the SA node is generated electrical impulses, then the atrial flutter occurs. The QRS complex is normal, but more than one P wave between the two QRS complex. This is called the atrial flutter. The definition is it is rate is very fast to 250 to 350. It is rhythm is also regular or irregular, maybe happen. QR is also normal. The atrial flutter is very rapid pattern of atrial contraction. Unlike atrial fibrillation, atrial flutter's electrical activity in the atria is coordinated. Then the ventricular fibrillation. What is ventricular fibrillation? You can see here there is a wavy form. Like that, atrial fibrillation, the ventricular fibrillation is the same type, but here the electrical impulses cannot generated from the AV node. It means atrioventricular node, but it is mainly generated from the other multiple foci or other multiple ectopic foci rather than the AV node. Then the ventricular fibrillation occurs so that the ventricle cannot beat properly. This is called the ventricular fibrillation. The rate is unmeasurable. P wave also absent. PR interval not measurable. The definition. It is a medical emergency. It occurs when the coordinated contraction of the ventricle is replaced by rapid chaotic electrical impulses. As a result, the heart cannot pump the blood. If the ventricular fibrillation occurs, if we cannot treat the patient properly or if we cannot give CPR properly, then the really cardiac death occur. Then the ventricular tachycardia. In the ventricular tachycardia, there is you can see no P wave, just like a wavy form is formed. In the ventricular tachycardia, rather than the AV node, another another ectopic foci is originate the electrical impulses to beat the ventricle. So ventricle cannot beat properly in a rhythmic way. This is called the ventricular tachycardia. It is rhythm also regular, but rate is very fast, 100 to 250 beats per minute. Definition is that it is a arrhythmia characterized by a pulse rate more than 100 beats per minute, at least 3 irregular heartbeats in a row. It is a electrical signals causing the rapid beating originated in the ventricle. If the ventricular tachycardia cannot treat properly, then this ventricular tachycardia is replaced by ventricular fibrillation. Then asystole occur, then the sudden cardiac death occur. Then the types monomorphic, polymorphic and torsade point. Then the symptoms are chest discomfort, fainting, light headachenes, dizziness, palpitation, shortness of breath. Then the first degree heart block. In the first degree heart block, you can see here there are delayed SA node electrical impulses is generation. It means from the SA node the electrical impulses is generated but it is delayed. Okay. Then the first degree heart block occur. The PR interval is more in the first degree heart block. Then the P wave normal but PR interval is prolonged. The AV node is delayed mainly but not blocked. Then the second degree heart block. In the second degree heart block, from the SA node, the electrical impulse is generated but delayed, and these delayed electrical impulses cannot goes properly in a AV node. Then the ventricle cannot beat properly, so there is a missed beat may be happen. You can see here there is a P wave. In a P wave the PR interval is more, but in a P wave you can see there is no QRS complex. It means the ventricle sometimes it is blocked the AV node, block the QRS complex or ventricular depolarization. It is called also Mobich 1 or Wench-Black block. Then the rhythm is irregular, rate is the underlying rate as a rate. Then the second degree heart block type 2. How the second degree heart block type 2? This is also called the Mobich type 2. In the second degree heart block, there is a from the SA node, the electrical impulses cannot goes properly and the electrical impulses cannot transmit into the AV node, then bundle of Vis, then Purkinje fiber. So that there is a many more missed beat from the second degree heart block type 1. You can see here PR interval is more and there is a P wave but no QRS complex. It means ventricle cannot heart or ventricle cannot beat properly in a rhythmic way. PR interval normal or prolonged, then rhythm is regular or irregular. Then the third degree heart block. In the third degree heart block, there is a mainly AV node or SA node. SA node is beat proper or SA node from the SA node the electrical impulses goes properly, but in the AV node there is no electrical impulses originated, or from the SA node the electrical impulses cannot transmit into the AV node properly, so that the ventricle cannot beat in a rhythmic way and there is so many misbeat you can see here. This is called the third degree heart block. Then the rhythm is irregular but atrial and ventricular rhythm are independent. The PR interval absent and P wave is normal shape and size. This is called the bundle branch block. Which is bundle branch block? When from the SA node an electrical impulses is originated, then it is going through the AV node and then it is going to the bundle of Vis and the Purkinje fiber to beat the ventricle properly. So when the electrical impulses from the AV node cannot transmit to the bundle branch or the bundle of Vis or the Purkinje fiber, then the bundle branch block occur. There is a beat, you can see here, there is a graphical representation of this bundle branch block ECG. The rhythm is regular but P wave normal and QRS is wide. This is called ventricular tachycardia torsade point. In the ventricular tachycardia, we have previously seen that Ventricular tachycardia, the AV node cannot give proper electrical impulses properly. Rather than the AV node, another foci or another ectopic foci originated these electrical impulses in a rhythmic way, so that the ventricle cannot beat properly. This is the torsade D point. The rhythm irregular, rate is fast. Then the idioventricular rhythm. This is the idioventricular rhythm. You can see here no P wave. We cannot recognize any type of P wave, but QRS is white. There is a T wave. The QRS is very wide. P wave is also absent. Rate is very slow because we cannot recognize the P wave properly. Then the pacemaker failure. When we need the pacemaker, when the heart cannot beat properly, or when a heart cannot give any type of electrical activities to beat properly, then pacemaker is needed to pace the heart or to give electrical impulses from outside. If this pacemaker failure to pace, then here this is a graphical representation of this ECG. No pacing occur, or the pacemaker beat does not, we see does not, there is any type of pacemaker beat. This is a pacemaker failure to pace graphical representation. The pacemaker spikes we cannot find. Then the WOLF-PARKINSON-White syndrome. In the WOLF-PARKINSON-White syndrome, there is a T wave elevation we can see here. Okay, T wave elevation and the tachycardia also occur in the WOLF-Parkinson-White syndrome. So what is WOLF-Parkinson-White syndrome? When the extra electrical pathway rather than the SA node and AV node. In our normal heart, there is a SA node, then the electrical impulses is originated in the SA node, then AV node. But in the WOLF-Parkinson-White syndrome, apart from the SA node, there is another ectopic foci which is originated the electrical impulses in their rhythmic way. Then the WOLF-Parkinson-White syndrome occur. There is mainly, it causes tachycardia. It mainly diagnosed in the younger age. The rate is also normal, but the QR is usually white. The symptoms is chest pain, dizziness, fainting, palpitation, SOP. The electrical physiology. The electrophysiology is that it does not slow the electrical impulses as does the AP node done. Then the premature atrial complexes. When the premature atrial complexes occur, when the SA node cannot give the electrical impulses properly, then the another ectopic foci give these electrical impulses to the atria to beat in a rhythmic way. So the premature atrial complexes or depolarization occur. There is a P wave which is prematurely occur. This is a prematurely occur. This is called the premature atrial complexes. The rhythm is regular, P wave premature, positive, and shape is abnormal. Then the premature ventricular complexes. When the AV node cannot give the electrical impulses to the ventricle, then the another ectopic foci give the electrical impulses to beat ventricle. Then the premature ventricular complexes occur, or the premature ventricular depolarization occur. It means QRS complex is found in prematurely. This is, you have seen the P wave. This is a premature QRS complex. The rhythm is irregular, peer interval cannot measurable, and the QRS is white. Then the asystole. So what is asystole? A straight line when a patient cardiac death occur, or a heart cannot beat properly, or if or from the SA node or from the AV node, the electrical impulses cannot generate. It may be happen due to the lead failure, or the lead cannot place properly, or the cardiac death, or a death patient. Then the rhythm not present, rate not present, POA, irritable, QRS, everything not present. The causes of abnormal ECG: the irregular heart rate, irregular heart rhythm, abnormality in the shape of the heart, electrolyte imbalances, medicine side effect, high blood pressure, heart attack. This is the cause of abnormal ECG. So If you have any type of doubt, please leave a comment, and if you like the video, stay in touch with Mommy's lesson. So thank you.